Hi, thanks for joining me. In this video, I'm going to be talking about one-sided facial paralysis. This video will be mostly for clients and prospective patients, but acupuncturists will also get something out of this as well. I'll be describing a very standard way that a lot of acupuncturists treat one-sided facial paralysis. I may be doing things a little differently from other people, but I think no matter who you go to, if you get acupuncture for one-sided facial paralysis, you can expect to see a change in the right direction. I almost always start with scalp points, specifically the ones which calm the nervous system, and almost always the 5 at the top of the head. Acupuncturists will recognize those points as Du 20 and Sis and Song. These are great because they help to reduce stress, calm the mind, and they help to open the blood flow to the brain, which assists in reducing swelling and inflammation. I also teach these to my patients sometimes, and they love them. And as we know, there's always swelling inside the cranium whenever there's stress, anxiety, or depression. I also use 2 needles at the base of the skull, the gallbladder 20 points, also called puncture or wind pool, a very important point to open the neck and the circulation to the brain, and also a point traditionally indicated going centuries back for facial paralysis. I needle the muscles of the face near where the nerves enter the muscles. Those are called the motor points. If there are any ear symptoms like pain or pressure in the ear, usually I add a point like Sanjiao 17, which will become important later, and sometimes one of those small intestine or Sanjiao points in front of the ear. I also like to needle the neck, specifically the back of the neck, as well as the upper trapezius muscles, and anywhere in the area that I find is tight or tender. And I sometimes manually decompress the neck, although I don't do these 2 techniques and do the face in the same session. The reason is because I think it's too much for a person who's stressed, fatigued, and healing on such a big scale. For electrostimulation, which I think is imperative to use in combination with acupuncture, really any kind will be effective, either microstimulation or milliampere. I prefer microstimulation because it does increase ATP in the cells, which results in the breakdown of non-functioning tissues more efficiently, the breaking down and the clearing out of viruses, and also results in more building up and rebuilding of tissues that we need to function. It's also a very gentle type of stimulation compared to milliampere, which is the strong thumping type that you usually get from an acupuncturist, chiropractor, or physical therapist. For all of you acupuncturists out there, I prefer a mixed frequency using the lowest frequency and the highest frequency available on the machine. I use a machine that has 0.5 hertz and 200 hertz, and I set the machine to mixed so that it uses those 2 frequencies alternating. A few seconds of the low frequency and a few seconds of the high frequency. This is because the lower frequencies will stimulate the deeper structures, including the bones and the tendons, and the higher frequencies will stimulate the more shallow tissues like the cells in the muscles and in the skin. The nerve cells, the nerve tissue, is actually both deep and shallow, so I feel it's important to get as wide a range of frequency stimulation as possible. I also use red light, which I'm a big fan of, red and infrared light. So after I get the needles in, I tape the needle handles down so that I can attach the E-stem wires without the clips pulling the needle out. If you're an acupuncturist, it's important to make sure that you alter your needle insertion. So if you want to needle, for example, one of these, I think these are the zygomatic muscles. If you want to needle one of these muscles, it's really important that you place the needle angle at like 45 degrees to 15 degrees, somewhere in there, so that you can more easily press the handle down, which will require bending the needle without any discomfort to the patient. If you put the points in at a 90-degree angle and then try to bending the needle shaft will be too extreme and it will cause pain. And you already know that all those points can be needled at a almost transverse angle anyway, so it's really no problem. Okay, and then I attach the leads, and then I turn the machine on, and the red light is great because it increases ATP. It also gets absorbed into the body and gets carried into other places. Dig that, man. light is actually a photon, like a physical particle your body can absorb and transport to other places in your body. So there will be a mild but beneficial systemic effect. I love it. Red and infrared light is something I often recommend for my clients at home, and I have seen it make a noticeable difference for those suffering from long COVID brain fog and fatigue, concussion symptoms, and even anxiety if it is severe. Then I let that whole treatment work for about 25 minutes. I may let that go longer for someone who's younger, but for the most part, it's 25 minutes. There is a metabolic cost to acupuncture, so the longer you leave the needles in, the higher the metabolic cost, and the more rest that person needs afterwards just to recover from the treatment. So I try not to wear people out. So now I'm going to talk about temporary facial paralysis, the different types, how it's diagnosed, how it's treated in Western medicine, some of its statistics, and also my thoughts on stress and exhaustion, which I think are the primary drivers in all cases. Temporary facial paralysis on one side of the face, or one-sided facial paralysis, is caused by impairment of the facial nerve. That's also called cranial nerve 7. It originates inside the skull, the cranial nerve, on the underside of the brain, like the other cranial nerves. This area is called the brainstem. It's between the brain and the spinal cord. Thus, it's in the back of the skull and on the bottom of the skull, and is part of the central nervous system. The brainstem is the first of two places where the virus is thought to gather and be stored in its latent stage, although it's not as easy for the virus to make its way into the central nervous system as it is to hang out in the peripheral nervous system on the facial nerve, as we'll see shortly. Its main nerve travels out of the skull and splits into three smaller nerves at a ganglion, which is like a relay point just behind the ear. This happens to be at the acupuncture point Sanjiao 17. This ganglion is thought to be a second place where the virus can gather and go latent, and the more common place where the virus gathers and goes latent. The three branches then innervate the side of the face and reach the muscles around the eye, the nose, and the mouth, as well as the tear and salivary glands and the back of the tongue. Typically, one-sided facial paralysis affects people between the ages of 15 and 45, approximately. I didn't find any gender data, but I can tell you that in my practice, I see both cis men and cis women, trans men and trans women with one-sided facial paralysis. I see younger people and older people who come in with it. It affects about 40,000 people in the United States every year. Keep in mind, these are the reported or gathered numbers, and the number of people who get one-sided facial paralysis in a year may be higher than 40,000. It's common enough that I see it 2 to 3 times per year, and my acupuncture practice is rather small at this point. Acupuncture can be effective for facial paralysis in all of these cases. We see it in at least 3 diseases or syndromes. Those are Bell's palsy, Ramsay-Hunt syndrome type 2, and stroke. Also bear in mind that one doctor may diagnose a different cause or syndrome than another. In part, this is because doctors are not doing the tests or their other diligence that they need to accurately diagnose, rule in, or rule out. I've seen many patients who come in for one-sided facial paralysis or concussion or other neurological injuries and tell me the doc spent just enough time with them to make notes in the chart and then they were out. I believe this is in large part due to the hurried nature that the modern healthcare system, insurance system imposes on a doctor's practice, but also is an aspect of laziness. And the recovery rates for all of these presentations are relatively high or relatively good. So it's not as though an accurate diagnosis makes or breaks a recovery, but wouldn't it be reassuring to know you're on the right track? I think doctors really need to up their game as far as ruling in, ruling out, doing tests for that, and documentation, and communicating with patients. I hear that one a lot. I hear that about acupuncturists too. I've treated people who have been diagnosed with Bell's palsy or Ramsay-Hunt syndrome type 2, as well as people recovering from stroke. The recovery rates are usually quite good. Most people recover completely within 6 months, although I have seen people a year later who have some kind of symptom remaining. Sometimes all that's left is an uncomfortable sensation like stiffness or mild soreness. Something like 85% of people are really lucky and spontaneously recover within 3 weeks, although the statistics that I saw through the National Institutes of Health didn't say how complete the recovery was in those 85% of people. Recovery is much more complete if you start treatment within 72 hours of the paralysis, and less complete for those who start more than 72 hours after the paralysis. And a small percentage of people still have significant paralysis after a year, such that they still can't close their eyes or eye. This can lead to uncomfortable, uncontrolled watering or a very dry eye, neither of which is easily manageable while at work or working out or driving or taking care of the family. Or they cannot close their mouth adequately, so eating and chewing are very difficult. And for that small number of people, surgery is recommended. I haven't come across anyone in my practice or in my patient interviews who had one-sided facial paralysis and needed to get surgery. This may be because perhaps it's rare, or it may be that I am simply not seeing these individuals in my practice. I don't know. For Bell's palsy, the treatment of choice in Western medicine is steroids. The stats on steroids are good for this treatment. I don't like steroids at all, but if I had one-sided facial paralysis, I would definitely take the full course of steroids my doctor advised me to take, and I would do acupuncture. I would do both of those as soon as possible within 72 hours. As I mentioned, recovery is much more complete and much faster if you start steroids within 72 hours of the onset of the paralysis, and it's much lower or incomplete after that. For Ramsay-Hunt syndrome, if found, it's also treated with antibiotics. Now, I don't understand why they would treat a viral infection with antibiotics. To me, that seems like that's a very common problem in Western medicine, that they give antibiotics for things where there's no bacterial infection. Perhaps the antibiotics are to prevent some kind of secondary infection, or maybe the antibiotics assist the recovery in some way that I'm not aware of. But if you have Ramsay-Hunt syndrome, you probably will be given steroids in addition to antibiotics in addition to steroids. I didn't look closely at the scientific studies or statistics for how many people get better using acupuncture, because I've seen that it's very successful in my own practice. And I have a love-hate relationship with research generally, but especially with acupuncture research, because it is an outgrowth of white supremacy. But I digress. Yes, I am woke, and don't let the door hit you. Let the door hit you on the way out. Part of my bias against Western medicine research for acupuncture is also because I've seen a lot of the studies on acupuncture have contradictory results, or their methods are not that reliable, or the study size is small, or they use other therapies in addition, like herbal medicine or physical therapy. And of course, all the studies with herbal medicine and physical therapy, they all boast good results and good percentages. But to me, what matters is how much better my patients report they feel, which is always 20 to 50% better after the first session, and 80% or more by the time the healing slows down to what seems like it might be drawing to a close. Even 20% can feel like an enormous jump in healing in this situation, which feels extreme and unpredictable. And here's the beautiful part. I don't think I'm doing anything special. My approach may be the result of research, trial and error, and as a result, my acupuncture may look different from someone else's acupuncture, but that really only shows how personal it is to me and to my approach. I know any competent acupuncturist can help you recover because I have seen it. The last patient I had with one-sided facial paralysis went to another acupuncturist for her first session, and she got really good results. The only differences were that my needle insertions were less painful. The other acupuncturist was much more expensive and further away. The story is this. The patient called me while I was out of town, told me she'd been diagnosed with Ramsay-Hunt syndrome type 2 and was suffering facial paralysis and ear pain. And I told her to just pick anyone that was within her budget and her geography and go to that person. As long as they know how to needle the muscles of the face, that's all you need, in my opinion. And they should use electroacupuncture, electrostimulation with the acupuncture, but you will still get benefit from acupuncture alone, or from e-stim alone if you can do that without needles, such as transcutaneous electrical neuromuscular stimulation, or whatever that's called. And even with the drawbacks of the expense and the distance, my patient got the results she needed. She described them as amazing results. I really think that any acupuncturist can do this as long as they know how to needle the face. So if you're interested in a deeper dive into the science, the pathology, the mechanisms of healing, and some of the anatomy and physiology about nerves and how viruses affect them, then please watch the second video. That's meant for acupuncture students, acupuncturists, doctors, physical therapists, any student of medicine or practitioner of Western or Eastern medicine. Thanks for joining me. I hope you got a lot out of this video. My goal was to help you to understand one-sided facial paralysis more clearly in terms that are easy for everyone to take in. And hopefully if you are suffering from one-sided facial paralysis, you get the help that you need in a timely fashion, or if you know someone who is suffering, hopefully they get the help that they need in a timely fashion. I hope this video made a difference for you. If you need to reach out to me for any reason, you can reach me through Instagram. If you're watching this video on YouTube, I'll put a link to my Instagram profile in the show notes. Take care, everybody.